Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is August 20th, 2025. This video is on an article titled Catheter and Surgical Ablation for Atrial Fibrillation, a systematic review and meta-analysis published in the Annals of Internal Medicine in the most recent issue. And there was an accompanying editorial titled The Significant Benefits of Ablation for Rhythm Control of Atrial Fibrillation. AFib is the most common arrhythmia, causing 6.9 million strokes, 1.5 million heart failure cases, and 220,000 deaths annually. The ablation therapies restore son's rhythm, but the impact on heart outcomes is unclear. This was a systematic review and meta-analysis of 63 randomized controlled trials from 2001 to 2024. The cohort comprised of 11,161 patients. 8,709 had underwent catheter ablation. 2,452 underwent surgical ablation. Follow-up median 12 months, 6 to 144 months was total. Subgroups: paroxysmal versus persistent AFib, with or without heart failure, rate versus rhythm control. Statistics: mixed effects, Poisson regression, intention to treat. They searched 9 databases, the WHO database and the clinicaltrials.gov between 1987 to 2025. No language limits, bias low to moderate, publication bias in some endpoints. What did they find? Catheter ablation was associated with decreased ischemic stroke beyond 30 days, relative risk 0.63. Increased ischemic stroke in less than 30 days, that is peri-procedural, relative risk 6.81. Decreased mortality, relative risk 0.73. Decreased heart failure hospitalization, relative risks 0.68. Surgical ablation, there was a decrease in total stroke, relative risk 0.54, no mortality or heart failure hospitalization benefit. Limitations of the study: no individual patient data, clinical heterogeneity, potential ecological fallacy, 99 trials with crossover, sparse surgical subgroup data with heart failure. Key takeaways: catheter ablation improves stroke beyond 30 days, mortality and heart failure hospitalization. Higher procedural stroke risk within 30 days of the procedure. Surgical ablation reduces strokes but no survival or heart failure benefit. Endorses catheter ablation in AFib with heart failure per guidelines. The accompanying editorial commendations describes this as a well-designed study or of a well-designed meta-analysis of 63 randomized controlled trials. These findings reinforce that catheter ablation as first-line therapy for atrial fibrillation. Strong endorsement of benefits in heart failure patients. Their constructive criticism: they omitted patients who underwent pulse field ablation trials. This is a major limitation. Technological advancements not uniformly distributed across included studies. Surgical ablation findings possibly biased by inclusion of sicker populations. Editorial takeaways: strongly consider catheter ablation in AFib with heart failure. Long-term stroke reduction outweighs early procedural stroke risk. Surgical ablation with the left atrial appendage occlusion is reasonable during cardiac surgery. Further studies should include emerging technologies like pulsed field ablation. Eponyms related to catheter ablation: Michael Assigueri in France identified pulmonary vein ectopy as a trigger for atrial fibrillation in 1998. His foundational catheter technique derived from Assigueri's discovery was pulmonary vein isolation and is now the cornerstone of AFib ablation. The Cox maze procedure was developed by Dr. James L. Cox in 1987, a surgical maze of atrial incisions to block re-entry circuits. The Cabana trial was led by Dr. Douglas Packer, compared catheter ablation to drug therapy in atrial fibrillation. Castle AFib trial showed catheter ablation reduced mortality in AFib patients with heart failure. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by Master MedFacts at mastermedfacts.com.